just want to ask you a few quick questions and really help you understand how natural medicine and how natural remedies and how naturopathic medicine can actually help you with your menstrual cycles. Now, you're probably here because you have a menstrual cycle challenge like endometriosis or like PCOS, or potentially you're looking at starting to try to have a baby, or you're wanting to come off of the period. Now, if that's you and you went on the period because you were having menstrual cycle issues, or you were having painful periods, or you currently are having painful periods, or you're having heavy duty bleeding, heavy flooding during or before or after your period or ovulation, then this book has really been built specifically for you. Now, the doctor is fabulous at making sure that we are alive and we aren't suffering from dangerously high or dangerously low hormone levels, or dangerously high or dangerously low symptoms that could be life altering or affect our ability to live or die, right? And that is really great. That's what we want doctors for. But when it comes to lifestyle issues like period pain, really bad cramping, like really heavy flooding when you do have your period, or pain during sex, the options for doctors are quite limited. And that's where you get recommendations like the IUD or birth control, or maybe even antidepressants to help you deal with your emotions or your symptoms during or around your period. And that's really where natural medicine comes in. You see, a lot of our patients come to us because they're suffering from really painful periods, or they're having that crazy flooding, or they're having a point in their life where they don't want to be on the birth control pill, but they've had all these other issues, or they are wanting to fall pregnant and they've been told that they can't fall pregnant. You see, everybody, every single body, every single female body was built to reproduce. And all of our hormones can and do work harmoniously when they have the nutrients and the balance that they need. And we often see that patients, for instance, suffering from endometriosis, it's more than just endometriosis that's going on. There's usually a nutrient deficiency. There might even be a digestive issue, like a lot of our patients that have endometriosis also are suffering things like leaky gut, which you may or may not have ever heard of. So a small bacteria could have gotten into your digestive tract, and then it got into the bloodstream, and then it started to cause inflammation in the uterus. And one of the reasons it shows up in your reproductive cycle, or in your menstrual cycle, or in your reproductive hormones, is because that's the first indication of hormonal imbalance. And it's really, really common. So the way that we work and the way that you're going to read the book is it's really about understanding the chemical regulation within your body, right? So that you can understand, okay, for everything that I put in, or everything that I feel, or all the symptoms that my body is expressing, it's a way of my body, it's the way my body's telling me that something is out of balance. So when we work with you, and when Eva's working with you, she's really digging into what is happening. You see, before you actually start your cycle, you have major hormones that are at work. So if you're constipated, if you're in a lot of pain, if you're really bloated, if you're really emotional, like we have some patients who suffer from a condition called PMDD. It's really, really, really wild emotions just before you fall pregnant. And basically what happens is, if you're experiencing any of these things before you start your period, it tells us a ton about your estrogen and your progesterone hormones and your prostaglandin. And if we can identify what's happening just before you start your cycle, it tells us a lot about key hormones that are interacting and working together. Then during your cycle, we're able to see what's happening within your cycle. That could also either be hormone imbalances, or you might have nutrient deficiencies that are causing your actual menstrual cycle to be really heavy, to be really light, to be really short. We look at all of that, right? And then all the way up to ovulation and sex. So if you're having sex and you're having pain during sex, all of this is the earliest sign of hormonal imbalances, and is often the earliest signs of digestive issues too. Because if something's not right in your digestion, it shows up in all of your hormones. But if we can fix that one thing and get your nutrient levels right and get your chemical levels right, you'll find that everything starts to come in balance. Things that you never even thought are related. You might be overweight. You might have really bad sugar cravings. You might feel really tired in the middle of the day. You might have trouble falling asleep at night. All of these symptoms come together because they're related to a chemical imbalance within the body. And it's awesome, as bad as it sounds for me to say that, it's really good that you're actually having a period issue right now, because it's your body's earliest indication of that dysregulation inside of your body chemically. So The reason I share all this with you is because I really want you to open your mind. This isn't going to be the same as what you get from the doctor, because the doctors are limited in how they can support you. They're here to help us with dangerously high or dangerously low symptoms. So if you're struggling with something that's really bad and is life-threatening, they can support you. It's one of the reasons that they would prescribe birth control or antidepressants, because that's what they have available to you, or an IUD to support your body. So this is really going to walk you through natural options to support you. And Eva really teaches you a whole lot about what's happening, what hormones are interacting, so that you can better understand what could be going on or what could be out of balance. So if you're like me, you might enjoy reading the book, but you want to get help right now. Maybe you've been looking for people in the area that can help you with your endometriosis, or they can help you with your PCOS, or they can help you with your menstrual cycle. And you've been looking and looking, or you've been reading up about it, and you just want someone who can give you a second opinion to what the doctor's saying, like how Eva basically got started, or you want someone who's going to actually start to help you with your symptoms and potentially even help you get off birth control if that's what you're wanting to do. And then you're in the right place. So just to the right of this video, there is there's a calendar where you can actually book in a time for a 20-minute free introductory consultation with us. Basically, in this 20-minute consultation, we are going to go through all the different symptoms you're experiencing. And at the end of the conversation, we're going to give you feedback based on everything it sounds like is going on. So if it sounds like you have an estrogen challenge, or if it sounds like you might have something like a leaky gut, which is basically causing a bacteria to cause inflammation inside of your uterus, we'll talk about that. We'll tell you what it really does sound like, so that you can start to get some gauge on what could be happening from a chemical perspective or from a nutritional or a nutrient perspective that's causing all these challenges for you. And then at the end of that call, if we can support you, we'll talk about specific ways to actually get treatment and support and options for you to be able to do that. So this consultation is completely free to you. It's 20 minutes over the phone. And like I said, you can just go straight to the right of this video, and there are different times that you can actually book a call with us. Otherwise, read the book, get an idea of what is going on, get some information. You can see why we have patients all across New Zealand book in with us, because we're actually specifically addressing these menstrual related issues. We're helping women all across New Zealand that are either wanting to fall pregnant, wanting to come off their period, or suffering from endometriosis or suffering from PCOS. And they want to actually take control of their health versus be bound to birth control or IUDs. Or if you're like Eva, it's really awful when you do have an IUD and it doesn't work. You actually keep having all the same symptoms and the IUD doesn't work. So if you're any of these things, then I hope you really get a whole lot from the book. I think you'll find it incredibly helpful. Eva's a specialist in reproductive hormones and menstrual cycles, so you're going to get a lot from the book. And if you want help along the way, then just simply come back to this video, and you can actually book in a time to come and speak with us. And that's a free 20-minute introductory consultation. So I hope this helps, and I look forward to hopefully connecting with you very soon. Take care. Bye for now.